Welcome to Conversations with Kay. I'm Kay Ryder. And every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. It's my pleasure to welcome back Kate Webb. Kate is Vermont Representative from Shelburne, and she's the assistant leader for the Democrats in the House of Representatives in Vermont. And it's a great pleasure to have her back.
Thank you, Kay.
Nice to have you here again. Now, why are you running for re-election to the Vermont House?
I love the work. I love representing the people of my community and the state. I love being involved in the big issues of the state and trying to find solution. I love being able to work across party lines. I love being able to work with people in general to solve problems.
Well, across party lines is very important right now. That's a word that we toss around, but it seems that particularly on the national level, it's not done much.
I think the January 2015, I worked with the assistant minority leader to put on a small workshop on civil discourse. So we had an opportunity to practice that. Attempted throughout the rest of the session to continue to work on that, and it's an important part, and I think that this is what Vermonters want us to do.
Right. I always remember Barbara Snelling saying you wear many hats, and you disagree with someone on something, and you have on a certain kind of hat. Then you go into another issue, and you put on a different hat because you agree with this person. Right. So there you go, and that's what keeps the ball rolling. That's good. Okay, now Vermont is not required by law to balance its budget. Most states are, actually. In recent years, the state has not been able to raise the funding it needs. It's made many times what I think are arbitrary budget cuts, certain percentages or whatever. Can this trend be reversed by not raising taxes?
Well, even though we're not required to balance the budget, we do balance the budget every year. By the time we leave, that budget is balanced, so we do it anyway. Now, that doesn't mean that things don't change along the way, so we have budget adjustment process where we have to make changes along the way. Sometimes a fund does not come in as we thought it would, sometimes it comes in better, and we need to make changes. I think when I arrived in the legislature, we were just entering the recession. So my entire time in the legislature has been recovering from that recession. And we're now seeing that I think we are making some progress in that. This last biennium, we are looking at budgeting not just being, we got to make cuts, we got to make cuts, we got to raise taxes, but really looking at what are some of the structural changes we need to make in the budget now that we have something that we're calling the new normal. And we're now looking at a different way of budgeting, which is very exciting, using something called results-based accountability. And this is now requiring the agencies and the committees to do a deeper dive into programs. What programs are really meeting the values that we hold in Vermont? There are basically three questions to RBA, results-based accountability, and one is what is government doing? How much are we doing? How well did we do it? And is anybody better off? And that is, anybody better off is kind of an important question. Are we continuing to invest in the typewriter repair department? Or do we need to maybe think of a few other things? If we're looking at something like the opioid crisis, are we duplicating services from one agency to another? Or do we need to kind of look at that as something that's an overarching responsibility that we need to look at? So I think that you will see in the coming years a change in the way that we're budgeting, looking at structural change.
Well, I think that would be good. I think in a way you're talking about how to use the money to do the best things for the most people.
Right.
Is that correct?
Yes, and sometimes it's not just the most people. If you look at something like homelessness, and you look and see, okay, what are we doing about homelessness? Well, we have a motel voucher system. Is anybody better off with that system? Or is there another way that we can do it? And are there ways that we can do it that may help to solve the problem so that people are actually better off. So we're looking at it in that way rather than just what's the motel voucher budget for this year.
Right, yeah. I think that's a good idea.
Yeah.
Now, it seems that Vermont has lots of taxes, and some of them, of course, are estate taxes, high estate taxes. Do you think that wealthier Vermonters have fled the state because of this tax?
I think wealthier Vermonters leave this state for a variety of reasons. I think one is we do have the word snowbird, so people leave for the weather, that they just get sick and tired of the weather. I think the second reason is wealthier Vermonters pay probably a higher income and property tax in Vermont, so that would have them leaving. The estate tax is actually something that we're in discussion. We discussed a little bit last year, may come up again as something that it should be on the table.
Yeah, I mean, you're right. I think that the weather definitely is a factor. No question about that. When you get older, you can't walk as well on the ice and everything like that. You want to drive through all the weather.
Yes.
But I do think that the taxes, of course, the wealthier Vermonters, if they keep their property in Vermont, they're going to pay the property tax anyway. So that kind of leaves me wondering about the estate tax. But I'm glad you're going to look into that.
Yes.
That's good. By the way, what committees are you on?
Well, at the House, we're on one committee. And I have served on the Fish, Wildlife, and Water Resources Committee for my entire time, working primarily in water-related issues. I also serve on the Joint Rules Committee and rules things that the leadership, that my position is involved in.
Yeah,
but I'm looking perhaps to not look at that for next year. I'm looking at a change. I'm going to wait and see on that before I state my interests.
You have to be reelected, just a little thing.
I have to be reelected. I am unopposed, so I'm feeling pretty good about a write-in candidate at this point. So
yeah. Well,
I don't want to be overconfident, however.
Oh no. But you've done a good job, I think. You pay attention to your people. You answer your emails, which is extremely important. Sometimes people feel that if they have a question and they call someone or they email someone, it goes down some magic black hole someplace and never gets answered. So that's good that you do that.
Sometimes people don't realize that we don't have staff, so I'm the one answering those emails, and that is the beauty of having not a large. I think I represent around 5,000 people, so I'm accessible, and I think that Vermont likes to keep it that way.
Yeah, and not having a staff is very difficult because as we talk, the audience will realize that Vermont is facing a lot of problems that bigger states face, and in the other states, people have a staff to delve into stats for them and information and what other states are doing. And you have to do that. And that's hard to do. It is difficult. Let's go back to the funding here just briefly again. Do you think that the state, I mean, we have limited funds, all states do, but do you think that we've been spending our money wisely lately? I mean, I think in terms of the health care exchange and the money that was spent on that, particularly for the consultant, I mean, very few results from that, really.
I don't think that I would say very few results is accurate, but what I would say is much of the money that was spent was federal dollars. Now, those are taxpayer dollars, let's be clear on that, but primarily federal dollars that were used. And I think the Affordable Care Act set that every state in the nation was looking at and dealing with, and there were a lot of examples that did not do well. Our state is one of them. I think that the primary problem there was just an unrealistic timeline. So we were given a year to do something that it seems like probably needed 3 years. I can remember the first year when Oracle was, we had the website was presented to us in a PowerPoint presentation. And I can remember looking at it and going, okay, when do we get to try it? And that didn't happen. So that was sort of a, uh-oh, do we have something to worry about here? So yeah, it was too big a task in too short a time. And I think that we are still recovering from that.
Yeah. And although we had federal dollars that were being used, it still didn't look very good in the end, did it?
It didn't. And let's also remember that now we are the second lowest state in terms of the uninsured. We've got 3.7 or 3% that are uninsured. Now, those people that used to not be insured, the problems for those people is number one, healthcare funds, healthcare debt is one of the key contributors to bankruptcy.
Right.
You also have the medical professionals, the hospitals that are unpaid. Who's going to be paying for that? So we can now boast that. So I would say that that's something that is a very large improvement. And from what I understand, we are now 2 years into, we have 2 full fiscal years under the Affordable Care Act. And my understanding is that the changes between 2015 and 2016 are very good, that actually we're coming in under budget in some of those areas. So.
Well, that would be a great change and
Yes.
really wonderful. One thing that Vermont has done, they've done very well by their young folks, by their children.
Yes. And hopefully Dr. Dinosaur 2.0 will help. I know we didn't have this. We didn't have any health insurance for my daughters when they graduated from college. And so you're left in that kind of quasi-problematic area.
Obamacare helped with that.
Obamacare helped with that.
Yep,
Yeah.
definitely. And
Yeah.
that's a good thing to do.
Yes.
Because particularly during the recent recession, I mean,
Yes.
people would graduate from college. It took them a while to find a job.
Right, right.
So it's very important to bridge that gap, if you will.
And our hope has always been to decouple insurance from the running of your business. That was a real hope.
Right. Now, another thing that is involved is it doesn't sound like a lot of money. I mean, $3 million, but, the Vermont spent money on the GMO, setting up a GMO system,
Right.
Labeled genetically, treated, engineered, if you will, foods.
Yes.
And the state's version of this bill was effective for a very short amount of time. And then the feds kicked in with their bill.
Right.
Now, do you still support what's done there with the GMOs?
Absolutely. This came from grassroots. People wanting this simple transparency. I think when we started working on that bill, 2012 is when I started working on it. We knew that if we were to bring this forward, that we might get sued. Now, if we might get sued, what do? Do you decide, we aren't going to stand up to anybody that's going to sue us? I don't think that's who we are as a state. But I think it is our responsibility to say, what are the risks? And are there ways that we can perhaps win? And our bill was designed to deal with 3 legal arguments to make sure that we would prevail there. And we were prevailing in court. We made it through the district court. We did very well there. It was in the Second Circuit. I listened to the transcript when it was presented, and we were looking like we were doing really well there. So we spent, I think it's $2 million that was spent. The legislature appropriated $1.5 million, and then we also received, I think it's $555,000 in donations from around the country. So we spent about $2 million. I think about $500,000 of that is actually covering salaries of people that are already in the AG's office. So now I want you to compare that to just last year. Those lobbying against labeling in Congress spent $101 million lobbying to defeat our bill. So, and they tried to turn the argument into this is anti-genetic engineering, and our bill was not anti-genetic engineering. Our bill was about transparency. Our bill was about consumers having a right to make an informed choice for a number of reasons. And, that the genetic engineering, some people were very much against that, but not everybody. There's nothing in our law that said there was anything wrong with it. But they got the airwaves, and they convinced the Democrats in the high ag states. So,
now the federal government has come out with such a law, and they are being labeled.
It's
foods
a
are being
terrible law.
You think it's a terrible law? Why?
It's a ridiculous law. I mean, what we were looking for was transparency. First of all, they've sort of wiped out the definition of a number of products that some of us would care about. Two, they've required mandatory labeling. So this is how you find out if a product has been labeled. Ours said it had to have a label on it that said produced or partially produced or maybe produced with genetic engineering. That's all it had to say. This is what the federal government this is what Congress came up with. You can go into the store with your smartphone. Everybody in the country has a smartphone.
Oh, of course, yeah.
Then let's say you have that. Now you go into your store and you start scanning. Okay, in my store, I don't really get the internet, so I'm not going to be able to do that. And then third, if I get that far, then I have to maybe go to a website that's going to tell me information. I'm going to have to scroll through the website. Now let's put a 3-year-old or a 2-year-old in my grocery cart as I'm going through this store and I'm trying to find out. I mean, where's transparency in that? It's completely absent.
Yeah, for many products.
Yes.
Many products.
Yes. And so I think if we try to be positive about it, which is a challenge, we can at least say, okay, there's something on the books now that maybe we can tweak it.
Right. That's a word that Helen really used to love when she was in the state senate. Helen says we can tweak that.
Yeah, exactly.
But it's true.
Right.
It is true.
Right.
Yeah.
Right.
And I think it's important to state that not against the products.
No.
Just wanting the people to be able to know it was treated that way.
People want to know for a variety of reasons.
And I think that's very important because there are those in agriculture who say that the GMO-treated products have given people food all over the world. And so it is important to realize and say you're not judging, you just want people to know. That's a good point.
Yes.
Okay, now Vermont has, you said a little bit about this earlier, Vermont has a drug problem. Very, very bad opioid crisis. With drugs flowing into the state from New York, Massachusetts, and Quebec. Is there a way to stop this? Can we? No. Yes? It's a big sigh. Probably no.
I don't know. I don't know how we stop that.
Yep.
I don't know how we stop that. I think what our state is looking at more is who's buying it and why. And if we can at least reduce the market, then I think that's something we have more control over.
Right. Now, it's interesting, in our area, the United Way of Chittenden County has become the United Way of Northwest Vermont. Mm-hmm. And you have Franklin County, Chittenden County, and the islands,
right?
The Champlain Islands. And one big thing they are going to look at is this opioid crisis.
Right.
Do you think this is a good way for the future to do it this way?
Absolutely. I think that it's at least a way that we can start to address it. We're looking at hub and spoke ways of having more people have access to treatment. Is one of the things that we're looking at. We're looking at better registry of controlled substances. So
through MDs, right?
Yes, and through the pharmacies, so you can't go get it one place and another. You talk to people who come home from surgery, and the number of opioid, the oxycodone or whatever that they have.
The oxys, right?
I needed it last year. I think I used 1. I think I was given 10. So what happens to that? So we create drug, take-back programs. We're also looking at, we've also tasked the Department of Health to start rulemaking on just prescription practices, on how we prescribe. I think, from what I understand, the the medical world had been under-prescribing for pain for a long time. And they kind of overreacted a little bit here. So we need to bring that down.
And the doctors, particularly the internists, were and after surgery, and of course the surgeon sends someone out with just a certain number of pills that they can have. Then the other drug prescriptions come in under the internist, if you will, or the private practice doctor, and they said, hey, people are hurting. What are you going to do about this? And now they've gone back the other way. Now they'll have to find something in the middle. I have had 2 big operations, and I know that I needed stuff. So if you need it, you need it. But
exactly,
it has to be monitored, and I certainly agree with that. Another health care issue that's sitting there, which is going to come, and we know it. Vermont is aging, and older people need a lot of what's called long-term care. Whatever they have is not going to go away. And the legislature, is the Vermont legislature beginning to really look at, if you will, a broad spectrum of services which are needed for long-term care?
I'm probably not the person to speak in a highly knowledgeable way
Ann
on this.
Pugh's coming later.
Ann Pugh will be nailing that question for you.
Yeah.
I would be asking her more about that. Again, I think if we're looking at the budgeting process, and we look at, for example, results-based accountability and the difference between just cutting. So if we cut funds to the adult daycare centers, you have someone that's living with family, they go to adult daycare during the day, the family continues to be able to work, it works really well, it's a great situation for everybody. But you say, well, we're going to cut money to adult daycare. Now what have you done? Now you've kept the son or daughter at home. Now they don't have an income. So in terms of the budgeting process, I think that we take, again, is anybody better off in the results-based accountability very, very seriously when it comes to elder care.
Right, and I'm thinking particularly in elder care, Alzheimer's, which is not covered by Medicare. Most of the adult day programs in Vermont, I believe, have 1 day of Alzheimer's. And what a blessing this is for families.
Yeah, that's they call it the long goodbye.
That's right.
Yeah, it's really devastating to families.
Right. And one day a week where somebody's safe. Now in Alzheimer's, that's particularly important, that someone is safe in a quiet atmosphere, and it's a great program. Let's move on here. Do you think that Vermont is anti-business?
Absolutely not.
Why do you say that?
I think that we do a number of things to promote business. Number one, we're known for startup. We could be number 1 in the country. We're in the top few for startup businesses. The tech businesses that we have spoken to, that have spoken before our committees, have said one of the things that they like the most is the access to government people in setting up a new business. I'd need to know specifically sort of what some of the concerns that folks are having. I know that they're concerned about some of the environmental concerns.
Act 250, right.
Act 250, okay, well, it's Act 250 that has helped keep our state clean and green, and that's actually one of the things that's going to be attracting businesses here. It's something that they want.
Now, Kate, you are a Democrat. We have 3 branches in Vermont now, the Democratic Party. You have the power. Do you think it's good for one political party to have such much power?
I don't know if I would say it's good or bad, but I would say more, let's look at how it's functioning now. And very often what people will see in the news is what happens on the floor of the House and what happens on the floor of the Senate. But what you don't see is where the real work of the House and the Senate is, which is in the committees. Our committees are set up to be totally tripartisan. Most are chaired by Democrats. 1 is chaired by a Republican. Vice chairs are typically Republican or a progressive. And if you look at the votes the real work that's being done in a committee, where you're powering into it, asking questions, continuing to work through questions and make adjustments to a bill, that's where it's happening when it's coming out of a committee 11-0. I'm seeing that the work is being done to listen to other parties. I heard it once said, I think my first year, the job of the majority is to set the course. The job of the minority is to point out the rocks. We listen to the rocks. It's an important part of the argument. But if we just stay stuck on the rocks, we're not going to get anything done. And I can tell you that we don't always get along, the House, the Senate, and administration. We have had a number of times where the three branches are not in alignment.
Right. I don't think that a lot of people realize how much work goes on in the committees and how the committees are structured. And I'm glad you brought that point out, because that is, again, that's an important point for people to know. Right now, what do you think are the biggest issues Vermont is facing?
I think one of the things I'm most interested in addressing next year is continuing with the restructuring conversation about the way that we fund government. We had a study done a few years ago by the Blue Ribbon Tax Commission that was looking at the way that we raise money. I think now that we're doing a deeper dive into the way that the agencies are funded, to bring that conversation back. I think that's our next growing edge. I feel like since I've come in, we've worked on a number of issues that were very important. We worked on the landmark water quality bill, a landmark education bill. There's some others that I'm forgetting at the moment, for the Affordable Care Act, of course. But I think that that's the real growing edge.
Okay.
Yeah.
Well, and very quickly, what do you like best about your job as a representative?
Yeah. I think it's being in the conversation that are important to Vermonters. Having access to experts is a wonderful part of the work.
Good.
That
well,
we do. Yeah.
You know, thank you for coming here and conversing with me. It's been fun again, and I wish you success, and thank you for your public service.
Thank you.
And thank you for joining us on Conversations with Kay.